So the Institute of Medicine and the Robert Wood Johnson worked together and funded a collaborative. They looked at what is the future of nursing, and they went and dug into the literature and did some research and found that hospitals that had higher numbers of BSN nurses actually had better patient outcomes. At that point, they really made the recommendation that the entry level for registered nurses should be a Bachelor of Science in Nursing. And they have set this national goal that by 2020, 80% of practicing nurses should have their BSN. Our nurses are in their 40s and 50s, many of them that do not have their Bachelor of Science, and really may be one of the major breadwinners in their family. So they really could use some assistance with going back to school. The piece we're really looking at is how do we have better outcomes for our patients here at Sentara? And this is one of the ways we think will really move us a bit more in that direction. I can tell you that nurses touch lives. I lost my husband 3.5 years ago to a brain tumor. And those nurses that took care of my husband really were there with me every step of the way. They were the folks when the physicians may have left the room, that they were there making sure that Dennis, my husband, was okay, making sure I understood what had happened. So it really means a lot to me personally, and I think it does to patients all over this region. When I talk to the nurses around Sentara and I ask them why they became a nurse, almost 100% of them will tell me because they wanted to help people. It's a great calling, and you really do touch people's lives. So I would say to the donors that contribute to this is that you really are partnering and making healthcare in our community better. And I appreciate that, and all the nurses really thank you for that from the bottom of our heart.